And so we'll just go over this one more time, just for anybody who came in late. So the number one killer of adults in the United States being heart disease, followed by some other. You're not going to be held responsible for knowing all these, trust me. Just know that heart disease is the number one killer. All the following risk factors for heart disease, except mild to moderate exercise, anything that's protective against heart disease: hyperlipidemia, high cholesterol, smoking, number one preventable cause, diabetes, hypertension, physical inactivity. Obesity is a better word than overweight, and diet high in carbohydrate, really simple carbohydrates like sweet. You do need carbohydrates in your diet, and fat, mostly saturated fat. Things like advanced age, sex, not lack of, meaning male sex is more prone to female sex, although that changes once a female reaches menopause, and a personal family history. The reason these risk factors are grouped separately because these are non-modifiable risk factors. You can lie about your age, you can't change your age. Yeah, you can change your sex, but that doesn't really change your risk factor. And you can pick your friends, but you cannot pick your family. But all the risk factors on the left side here are at least modifiable, if not controllable. So it's something to keep in mind for your own personal health. A heart attack occurs when muscle tissue dies because its blood supply is severely reduced or stopped. And we'll just go over the quick video about what a heart attack really is. Nobody's hearing it? Is that what's going on? Oh, I'm sorry. Oh man, I was hoping that was going to work. Okay. All right, I'll try to post that video up on the lesson plan so you can see it. Although there are plenty of videos to go by. Can anybody tell me what the difference between a heart attack and cardiac arrest is? This is something you gotta know. Leslie, sudden stop of what? The heart and breathing. Very good. So cardiac arrest is the sudden stoppage of the heart and the breathing. So when the heart stops beating, blood does not get to the brain, person becomes unconscious, breathing shuts down. And how much time do you have before irreversible brain damage occurs? 4 to 6 minutes. Excellent. Okay, 4 to 6 minutes. Where a heart attack, which is really kind of a catch-all phrase for a lot of different things, in a nutshell, is damage to the heart, like Olga said, is when the tissue dies because of a blockage. The heart itself is a pump, it's a muscular organ, and it gets its blood supply by all the arteries that surround it, called the coronary arteries. If one of these arteries gets blocked up, whatever area of the heart that's being fed by that artery is going to break down, become damaged, and ultimately die if it's not fixed. Now we're going to talk a little bit more about heart disease and heart attacks when we talk about medical emergencies. We're also going to talk about more of the first aid for heart attacks and a little bit of what happens when they're actually brought to the hospital and how we intervene and how we try to correct the situation. All right. So next question. Which of the following are common signs and symptoms of a heart attack? And yes, it's one of those all of the above questions. So chest pain is usually the most common symptom, although it doesn't always have to be pain that an individual is feeling. Sometimes it can become, they can describe it as just an uncomfortable sensation, a pressure, uh, like sometimes like an elephant sitting on their chest. 5 people in front of me could all be having a heart attack at the same time and describe it 5 different ways. Another common sign and symptom is nausea, feeling of lightheaded, severe fatigue. I did have a patient come into my office one time. He was a man, early 50s. Didn't look like he was in that bad a shape, but his chief complaint is, I don't know what's got into me. I can't catch my breath. I feel exhausted. No pain at all. But he just felt like something was wrong. Something was wrong. He just couldn't catch his wind, which was his exact words. Okay, so being that he was male in his early 50s, we got him in the room, we got an EKG, and boom, this was a massive heart attack occurring right in front of my eyes. So he didn't have any pain though, so sometimes you have to have a high index of suspicion. Sometimes you may feel the pain other places, like in the jaw, neck, or back. So you have a 60-year-old smoker who's all of a sudden complaining of jaw pain for no reason, thinking maybe it's some dental work they need. Sit back and reevaluate that individual. Ask about how long it's been going on. What were they doing when it started? Do they feel anything else? Look at their other risk factors for heart disease as well. Do they smoke? Do they have hypertension? Do they have a history in their family? Pain and discomfort in the arm or shoulder. Sometimes chest pain can radiate to other parts of the body. That's something we call referred pain. And of course, shortness of breath as well. So those are the most common signs and symptoms. Blank results when the heart stops beating. Well, we just talked about that, cardiac arrest. And I'm sure you're not gonna probably watch this video in my presentation, but you do have it. You do have the homework open, and you can always go back and click on it and watch it. Same thing with the previous video. CPR consists of which of the following? Moving blood to the heart and brain by giving chest compressions, providing periodic breaths to place oxygen into the victim's lungs. And the answer is both of the above. Cardiopulmonary resuscitation moves blood to the heart and brain by giving chest compressions, by actually 2 mechanisms. Squeezing blood out of the heart on the compression downward, and siphoning blood back into the heart on the release upwards. So both are just as important. Remember, it's important to push down and allow full recoil in a controlled pace when you're doing CPR compressions. Age parameters. For the purpose of CPR, we know that all of the above. An infant is less than 1 year old. A child, just for definition purposes, is 1 to the onset of puberty. And an adult is from puberty on. Just basically textbook definitions. All right, so what's the most important step in CPR? And that would definitely be the compressions. The compressions are really vital. These are what are going to keep the brain cells alive, especially in the first few minutes of CPR. Check for responsiveness, yeah, of course, but if they're not really showing any signs of life, you're probably not going to get much of a response. Breaths are important, but if the breaths that you're putting into that person's body are not being circulated around to the brain, it's really not going to do much good. And to tell you the truth, in the first few minutes of CPR, if you do not have any type of barrier device to give rescue breathing, and you do not want to give mouth-to-mouth on somebody, compressions alone or hands-only CPR is completely appropriate. There's still enough oxygen in the bloodstream for several minutes once the breathing stops to keep the brain perfused if it is circulated to the brain. Now, this is not textbook real. There is also some research suggesting that compression-only CPR may actually be better than compressions and breaths together. There's some thought and research that just the compression and the release of the chest alone provides enough positive and negative pressure in the lungs to bring enough oxygen into the system by itself to circulate into the brain. Hasn't been fully studied yet, but it is a thought that's occurring. Which of the following is not indicated when giving compressions? Well, you want to push hard and fast, compress the chest at least 2 inches for the adult victim, compress with 2 hands on the adult victim. But if the patient is lying in bed on a mattress, you're really not going to get effective compressions. So you want to make every effort to get that person off of that soft surface and onto a hard floor. If you're doing compressions on a patient on the bed, what's going to happen? You're going to start pressing on their chest, and they're going to start bouncing up and down, and then you're going to start bouncing up and down, and the two of you are going to start bouncing up and down, and it's just going to look really weird. So just keep that in mind. Sometimes if you can't get that person off the bed, you do the best you can. What is the rate of compressions when giving adult CPR? Simple textbook guideline, 100 to 120 beats per minute. Remember, the best performed CPR only restores about 30% of the normal cardiac output. So it's important to do effective compressions and fast compressions. Normal adult heart rate at any given time is usually about 60 to 100 beats per minute. So we want to do a little bit more to compensate for that. How long should a single rescue breath last? And again, simple criteria. You have it all in the material that I put on your blackboard. 1 second. Signs of a severe complete upper airway obstruction include all the following except weak and ineffective cough. No, that's a pretty severe airway. Inability to speak, severe airway compromise. Bluish color in the face, severe amp. Strong, forcible cough. If they're coughing forcefully, they are moving air. Leave them alone. Encourage them to cough up whatever in there. Keep an eye on them. Do not slap them on the back. Do not shake them back and forth. Don't slap them in the face either for that matter. Just encourage them to cough. If you say, "Are you choking?" and says, "Yeah, you moron, I'm choking, do something," they are not choking. Just keep an eye on them. And if you do not know what I'm talking about, please watch the video. If you suspect a victim is choking, the first thing you should do is ask, "Are you choking?" As I just said before, if they say, "Yeah, I'm choking, I'm choking." Any Met fans in the house? Oh, sorry. That was a little tangent. If they say they're choking, then they are not choking. Do not intervene. If you do notice that they do confirm that they have a complete airway obstruction, well, watch the video to understand the technique. What was previously called the Heimlich maneuver, or abdominal thrusts. Put your fist with the thumb right over the belly button, other hand over that fist, and you want to push in and up, in and up. How long do you want to keep doing Heimlich compressions until? Can anybody answer that question? Is there a number? 5, 10, do 30 seconds? Okay, you're going to keep doing abdominal thrusts until one of two things occurs. Either the obstruction is relieved, the person starts breathing and coughing and breathing on their own, or they become unconscious, in which case you assist them to the floor and you do something else. If that individual relieves their airway and you got the obstruction out, whether it's adult, child, or infant, it is highly, highly recommended that they still be seen in the emergency room to evaluate that airway. If there's been some trauma to their trachea, to the windpipe, with that foreign body, you may have relieved that object, but secondary inflammation and swelling can occur later on, and that's something that has to be watched out for. So just keep that in mind. Does anybody know what to do once that person has become unconscious? I'll give you the first step. Send somebody for help if you haven't already. Your choking victim has now just become unconscious. What do you do immediately? Is my microphone on? Yeah, I already said that. Send somebody for help. You guys are not reading the material and ask for consent if they're unconscious? No, once they become unresponsive, once they drop to the floor, you want to go right into CPR. CPR. You're not so much worried about cardiac arrest, but A, you want to get whatever oxygen is still in their blood to the brain. B, CPR compressions themselves may help dislodge that object. Once they become unconscious, it may actually be easier to dislodge that object because all the muscles in the throat, as well as the rest of the body, have become limp, unresponsive. So they may become a little flaccid and it may loosen up. So those chest compressions may actually relieve that obstruction. So you do the 30 compressions in the adult or child, infant if you're alone. What's the next thing you would do after your compressions? What's the next thing you do after the 30 compressions on the unresponsive choking victim? Before giving 2 breaths, remember it's a choking victim. We know they're choking because they were choking in front of our eyes and they just collapsed to the floor. Everybody's so shy today. Oh, Ryan wants to do mouth to mouth. Okay. Okay, well, you know, hey, no judgment. Check if they have something coming out. I hope you mean out of their airway. But good answer. So basically, you want to open the mouth, look in the airway, look in the oropharynx or the mouth cavity, and see if anything came out and is floating around in that mouth. If you see something, sweep it out, and then give 2 breaths if you're so inclined to do so. If you do not see anything, you do not give any blind finger sweeps. You still try the 2 breaths because just because it didn't come out the top, it might have gone through the bottom and lodged in the right lung, depending on how deep that foreign body was in the airway. So you still try to give the 2 breaths, and if they don't go in, you go right back into compressions. The first thing the rescuer should do prior to performing CPR is, actually I have that, oh, you know what? I have that miskeyed. This is checked off wrong, so I'll have to reevaluate that when I grade the homeworks. Yeah, the correct answer would be check the scene for safety. That one got by me. Is it safe to provide assistance? Things that may harm you include fires, falling debris, risk of electrocution, other hazards, but other things as well. Even in a home, are there tripping hazards? Are there bodily fluids? You know, if this is a drug situation, are there sharp needles to contend with? Just always do a good 10-second survey of your surroundings to make sure you're okay. Along with assessing for the presence of a pulse, the rescuer should also assess the victim for which of the following. And the answer is breathing, movement, and responsiveness. Are they breathing? Are they moving? Are they talking? Are they breathing? Are they moving? Are they talking? Scan them up and down while you're checking for the pulse and ask yourself that question. If they say, hey, get your fingers out of my throat, they do not need CPR. If they start swatting you away, they probably do not need CPR. If you see full, deep, regular breaths, they probably do not need CPR. Remember in the presentation, checking for pulse is difficult. Even seasoned professionals sometimes have a difficult time assessing for a real pulse. If there are 2 or more rescuers performing CPR on a pulseless victim, roles of compressors and ventilators should be switched approximately every 2 minutes. Now, you try to time it as best as you can. If you're doing properly paced Good technique CPR. 2 minutes in the adult should take about 5 cycles of 30 compressions to 2 breaths. If you're doing 2 or more rescue or child or infant CPR, remember, the compressions are halved, the cycles are doubled. So instead of 5 cycles of 30 to 2, you're doing 10 cycles of 15 to 2. But that should still round itself out to about 2 minutes. Now, if you have an AED hooked up to the individual, it should time you, and it should alert you after 2 minutes is up. All the following are indications for terminating, stopping CPR, except at the family member's request. That's really not a good legal reason to stop CPR. Even in the field of EMS, if they don't meet certain criteria, we need to continue CPR until either A, the rescuer is too exhausted to continue. That might be an issue if you're out camping in the woods or in a very solitary environment. The victim demonstrates signs of life. They start breathing spontaneously, moving, talking, or someone of equal or higher training takes over, such as the paramedics or someone else, someone who's a nurse or someone who's also CPR certified or CPR trained, I should say. A couple of other situations when it's okay to stop CPR. Well, if you're working in the healthcare setting and the physician in charge, the ER doctor or the medical control physician in EMS tell you to stop, it's indicated. If the scene becomes unsafe for whatever reason, something is suddenly putting you in danger, well, obviously it's indicated to stop CPR and get the hell out of there and run. Also, if you are presented with a valid DNR, I think we talked about that first, one of our first classes, a do not resuscitate order. Maybe CPR was initiated, they couldn't find the DNR, and now they found it. That's the person's wishes that they do not want to be resuscitated. That should be respected. What is the ratio of compressions to breaths during 2 rescue? Oh, I screwed another one up, didn't I? Wow. I checked this out too. All right, so I think everybody's just going to get an extra 10 points on this quiz, on this homework. Rather than just, yeah, everybody's going to get extra 10 points. So what is the ratio of compressions to breaths during 2 rescue adult CPR? 30 compressions to 2 breaths. 30 compressions to 2 breaths. I'm going to change that. I'm going to give everybody extra 10 points. How should the rescuer compress the chest of an adult victim? How deep? About 2 to 2.5 inches. I hope nobody interpreted that as 21 inches. Rescue breathing for an adult victim consists of 1 breath every. Oh, I just messed all of these up. What the hell is wrong with me? 5 to 6 seconds. 5 to 6 seconds. You know what it is? In the presentation, did we talk about an advanced airway at any time? Probably not. If a person has an advanced airway, such as a tube, an intubation tube, stuck in their airway, then we do less ventilations. It's 8 to 10 seconds. I think that's why I mixed that up. I apologize for that. Everybody gets an extra 15 points on the homework. I try to be as fair as possible. Hold you to my screw-ups. All right, so before we move on, do we have any other questions? Any questions about the homework or anything about CPR so far? Or anything about anything in first aid? Oh, wait a minute. Hey, you guys are so shy today. I said make it 15. So if you got 100 on the homework, then you get 115. If I screw up, go ahead.
Sorry, no, I meant the 10 points for the first time that you messed up or something like that.
Yep. What about it?
Where are you going to give us that? And also this 15 points.
15. Yes, I just said 15 points.
I know. You don't get it. Is that it's going to be like 25 points, right?
No, it's gonna be 15 points. What are you, used
So
car salesman or something?
from the first
Trying to
time,
haggle with me?
from the first time, and from this time also. So it's going
Oh,
to be
the
like,
first quiz when I said you guys get an extra 10 points because everything
uh,
crashed?
yeah.
Yeah, that was already put on. And today, when I go over the grades again, I'm going to add 15 points to everybody's grade that took the homework. Okay. So now, any questions about first aid? Before we go over a review, I'll just take a few minutes to talk about this whole pandemic situation. I don't claim to be an expert by any means, but I have been working with it over the last 6 months. I have seen it clinically. I have been trying to keep up to date on the research. There's unfortunately a lot of misinformation out there, a lot of statements being made based on what we call anecdotes, word of mouth, rather than real hard medical evidence. If you guys want to take a few minutes and toss out some questions, I would try to answer them as best as I could. Or if you've heard something that is completely bogus, I can tell you hopefully why it's debunked. For example, that whole hydroxychloroquine thing, that was all based on very, very, very poor research. There are some promising treatments for hospitalized patients with COVID, but the hydroxychloroquine was definitely not one of them. Anybody have any questions they want to field? Anything they're curious about? And even the experts, there's still so much that they don't know. Well, my big advice to you is really try not to believe everything you see on social media. A lot of people go by word of mouth, such as what? Such as, I don't know, give me an example. If there's going to be a statement, if any research or any breaking developments have been made about coronavirus, it should be coming from a reputable source. Peer-reviewed articles, scientists. I would watch what politicians have to say about it. I definitely put my faith in Dr. Anthony Fauci. He's been working around the clock, nonstop, and his assessments are very logical and to the point. But when they try to find out facts about coronavirus, they try to base it on evidence-based medicine, meaning what's been proven to work, not just what should work based on faulty logic. So for example, we know that about 90% people get better on their own, 80 to 90%. 5% of the people tend to be hospitalized. There seems to be, depending on the resource, a 2 to 3% death rate. We know that mortality is more common in people who have underlying medical conditions like diabetes, asthma, obesity. We know that this virus has a whole constellation of presentations. You have your very common presentations, such as flu-like illnesses with cough, fever, chills, body aches. It's going to be very difficult to differentiate this flu season. But you also have very subtle and variable signs and symptoms as well. Sometimes just simple fatigue, simple cough, some types of rashes. And then you got the people that for some reason are, loss of taste, loss of smell. And then you have some people that just have no symptoms whatsoever. Back in the spring, I was testing a lot of firefighters and police officers where the virus was rampaging through their stations. And a lot of them just said, I'm here just to make sure. I'm not really feeling anything. I don't have a hard number in front of me, but a lot of them were positive. So, and it seems that small children, although they're not as badly affected by it, tend to be more of the silent carriers than adults. Interesting why. Well, in any event, would anybody like to preview what you might see next week or what might be covered on next week's exam one? I was going to do that anyway. Yes, please. Absolutely. There was no homework 3 due. Homework 3 will be due in 2 weeks. It will cover the next lesson, which is in 2 weeks. That might be a Wednesday. I got to redo the syllabus and check. All right, so let me just repeat again. Next week's exam number 1 will be at 2:10 regular starting time. Yes, everything. You'll have 75 minutes for 50 multiple choice questions. It's not a hard exam, but if you've not been looking through the material, if you've not been studying a little bit, if you've not been really practicing the homeworks and quizzes and going over the stuff that you don't understand, you might have a hard time with it. I think it's pretty straightforward. At 4 o'clock, you have 75 minutes to complete it. You have a little break. At 4 o'clock in the afternoon, we will resume and we will go over the test live to go over what went wrong, what was right. And then if anybody wants to stick around after that, who might be interested, we'll talk a little bit about our EMT program as well. I maybe think some of you might be interested in it. It might be a good stepping stone for other paths in the medical industry. Just, yes, and Getty?
Yes, I have a question. So the first test is gonna be about everything you give us, like you gave us, like for example, the first homework and then the second homework too, or just
Class,
about
all
the
at
second
once?
homework. It's like all in one.
Everything. Everything. I mean, obviously
Oh
not coronavirus, what we're talking about right now, obviously.
no.
But I don't test statistics because statistics always change. So, like the numbers of deaths of heart attack victims per year. I don't test stuff like that. I just want you to know the basics.
Okay, perfect. Thank you.
All right. So let's move on. Again, I'm supposed to be having information regarding certification. I'm supposed to be having a Zoom meeting with my department next week. Hopefully, I'll be having more information about that as well. All right, so let's share this. Let's see how much you guys have retained. Ah, this is the wrong one. Sorry about that. Give me 1 minute. Where am I here? First aid. 119. No, that's not it. Let me just give me a moment to find my here we go. Sorry about that. I think this is right. Did I lose everybody already? Okay, a blue circle. I'm just loading up the presentation. Takes forever. Exam 1 preview. That's what we want to share now. Okay. All right, I'm going to throw this out to you. You guys are going to answer all the questions. So, leading cause of death and disability in children and young adults is what? Read the question. The leading cause of death and disability in children and young adults is unintentional injuries, trauma. The leading cause of death in adults across the board in the United States is heart disease. So just remember that. First aid is intended to what? First aid is intended to provide temporary help until proper medical care, if needed, is obtained. Properly applied first aid may mean the difference between, as if you already didn't know the answer to this, very good. Consent to give first aid must be obtained from every victim who is the answer is D, all the above. They must be responsive. If they're responsive, you must obtain consent. If they're mentally competent, meaning able to make their own decisions, you must obtain consent. And if they are legal age, basically it's 18 and above. So the question answer is all of the above. If the victim is unresponsive, permission to give first aid is known as what? Implied consent. Implied. Make sure you read the questions properly. Don't mix up responsive with unresponsive. The victim is unresponsive. The law assumes that that person would want help if they were able to make that decision. A first aider must stay with the victim until another equally or better trained person takes over. A failure to do so would be considered what? Abandonment. Abandonment. Okay. May not be an issue as a person provider, but if your job description or any of your legal responsibilities include giving first aid, could be an issue. So the following statements concerning Good Samaritan laws is true. Okay, not fooling you guys. They protect first aiders acting in good faith. Correct. Who is a vital link between emergency medical services and the victim? The vital link is D. It's bystanders. It's you guys. Why are laypersons less likely to offer help when an emergency occurs in a public place? All the above. Lack of knowledge, confusion of an emergency is, and the characteristics of the emergency. In a serious situation, who would you call first? 911. What should the rescuer look for during the scene size up? Remember that scene size up? Your mom? Yes. And B, hazards that could be dangerous, the mechanism of the cause of injury, and the number of victims as well. Personal protective equipment includes, thank you guys, all the above. I'm just going to skip through the really easy ones. Which three body systems include the most important and sensitive organs? A, respiratory, circulatory, and the nervous system. Anyone? Anyone? Anybody gets this question wrong on an exam, we will find you and we will kill you. 4 to 6 minutes. Food liquid can enter the trachea by mistake if what structure fails to close? The epiglottis. Epiglottis. The smallest bronchi end in thousands of tiny pouches called what? Was E a choice? Alveoli. Alveoli. Oops, I just gave you the answer to that, didn't I? Which blood vessels carry blood back to the heart? Merry Christmas. Veins. Which artery should be used to check the pulse of an unconscious adult victim? Carotid. Carotid. What artery should be used? I'm going to throw you a curveball. What artery should be checked to find out if an unconscious child victim has a pulse? Unconscious child, where do you check the pulse? Oh, you guys are good. It's still the carotid. Unconscious infant, you would check the brachial. So it's a question I love throwing out there. What prefers to the circulation of blood to an organ or a structure? My favorite word. Perfusion. Perfusion. Everybody say perfusion. Loud and clear. Can't hear you. Get it? You don't have to yell at me. Which organs are part of the central nervous system? Going back to A and P. The brain and the spinal cord are part of the central nervous system. Good. The thorax is another name for what? If you want to smash somebody in the thorax, you want to smash their rib cage. Not that I would encourage anybody to do that, of course, because I'm a pacifist. Sort of. What holds the bones of a joint in place? The answer is A. Ligaments hold the bones of a joint in place. Ligaments attach bone to bone. Tendons attach muscle to bone. What is the purpose of the initial check? Leslie's got it right. Getty. To identify and treat life-threatening conditions. Anything that could compromise A, B, C. Airway, breathing, circulation. Victim's level of responsiveness or mental status can be described according to the what scale? AVPU. What does A stand for? What does the A stand for? I might ask you that. What does the V stand for? What does the P stand for? PU. A stands for alert. V stands for verbally responsive. P stands for painful responsive. And U stands for unresponsive. Go back and review that. Also remember that mnemonic DOTS and sample. Which method should be used to open the airway of an unresponsive victim? Good. Head tilt, chin lift. Head tilt, chin lift. To take the tongue off the back of the throat. If an unresponsive victim is breathing, the best position for the victim is let's go back and review this on the side in the recovery position. Don't read into the question too much. Very simple. Unresponsive victim is breathing. Best position, left side recovery or the Haynes position. Keep the airway open. Allow for drainage of any mouth contents. Something that the first aider sees, hears, or feels is a what? Uh-oh. What the first aider sees, hears, or feels is a sign. A symptom is what the victim tells you is going on. So chest pain would be a symptom. Sweaty skin would be a sign. Anything that you can physically observe is a sign. Which of the following is a symptom? Good, nausea. Using the mnemonic what can help you collect a victim's history? Sample. And let's have it. What does S stand for? Signs and symptoms. Good. What about A? Allergies. Good. What about M? Medications. Good. Medications. What about P? Past history or pertinent history. What about L? Last oral intake, last food, last time they had something to eat. And E. Events that led up to the emergency. Very good. Okay. What is the leading cause of death overall in the United States? Look at all your choices and pick the best choice. Very good. Cardiac arrest, sudden cardiac death as a result of heart disease. For effective chest compressions during CPR, the rescuer should push hard, push fast. Very good. During CPR, the rescuer gives what? Chest compressions and rescue breathing. Very good. If alone with an unresponsive adult victim, the rescuer should. This is tricky. Maybe not. Unresponsive adult victim, the rescuer should. For the adult victim, in an unwitnessed cardiac arrest, or witnessed for that matter, remember, what's the definitive treatment for cardiac arrest? Defibrillation. CPR is a means to an end. It is a bridge to defibrillation. So if you're alone with an unresponsive adult victim, call 911, come back, and then intervene. It's different with a child. If you're alone with a child, if you come upon a child in unwitnessed cardiac arrest, 2 minutes of CPR, then go make the call. Children usually go into cardiac arrest because of lack of oxygen. Adults usually go into cardiac arrest because of the heart doing funky rhythms from heart disease. When performing adult CPR, how many compressions should be given? D. What about to rescue adult CPR? Haha, fooled you. 1 rescuer, 2 rescuer, all adult CPR is 30 to 2, 30 to 2. Go over those sheets, go over those notes. When performing chest compressions on an adult victim, the sternum should be depressed at least 2, more like 2.5 inches. At least 2 inches, though. The ratio of compressions to breaths when performing adult CPR is, did I just repeat that question? 30 compressions to 2 breaths. At what point would you stop performing adult CPR to check for circulation? That's a tough question. The answer is D, all of the above. None, no, what does that say? That should say none of the above. Sorry, none of the above. Once you do an initial pulse check, at this level, you do not do another pulse check unless that person's awake and breathing and says, I rise! Because pulse checks are very, very unreliable. After initiating CPR, you stop the, I just said that. You do not need to stop and check the pulse again. A little redundant here. When giving rescue breaths to an adult, each breath should last approximately how long? One second only. How do you know your rescue breath is effective? There's no choice there. Okay. Yes, you see just a little bit of chest rise, and then you know your breath is effective. When performing CPR on a child victim, give how many breaths after 30 compressions? After 30 compressions, so you're assuming it's one rescuer, you give 2 breaths after 30 compressions. To perform chest compressions on a child, remember not to mix up child and infant. Perform chest compressions on a child from 1 to the onset of puberty. You use 1 or 2 hands. 1 or 2 hands. When performing infant CPR, give chest compressions at the rate of at least 100 compressions per minute. Good job. The signs of a severe airway obstruction may include difficulty breathing, weak and ineffective cough, inability to speak or breathe. The answer is D. When giving abdominal thrust to a choking victim, where should you position your hands? Well, sternum would be a good choice if your patient were pregnant or so obese you couldn't wrap your hands around their stomach. But under ordinary circumstances, which would be correct choice B? The answer is, nope, I screwed that up again. The answer is B, just above the navel, above the belly button. That answer is B. In the middle of the abdomen, just above the navel, the belly button, not below the navel. I have to re-edit these. The most common cause of airway obstruction in an unresponsive victim is what? The most common cause of an airway obstruction in an unresponsive victim is the tongue, their own tongue. Don't get dirty. All right. A child's age ranges from, and remember, this is for the purpose of CPR. Oh, God. For the purpose of CPR, in the context of CPR, 1 to the onset of puberty. During ventricular fibrillation, the heart does what? During ventricular fibrillation, the heart, C, quivers and cannot pump blood. It goes from this, boom, 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 to this. Yeah. If that occurs too long, it goes from there to. That's what happens in the first few minutes of cardiac arrest. The heart really doesn't stop completely. There's still some electrical activity occurring to the heart, which can only be fixed with the application of an automatic external defibrillator. Cardiopulmonary resuscitation. Good. Is the initial care for cardiac arrest until a defibrillator is available. Before using an AED, all the above. Give CPR until the AED is ready to be used. Position it next to the victim. Turn it on. Begin what? Immediately after the shock and follow the prompts of the AED. CPR. Okay, so that's enough of that. We have any questions? Who's going to get 100 on next week's exam? Without a curve. Joyce! Well, if it's any encouragement, I took it myself. I got 100, so you guys should be okay. All right, I'll stay on board if anybody else has any other questions. Otherwise, next week. Oh, and if anybody has any problems finding where the exam is, there'll be a tab. It won't be open, but if you're still having problems with finding the menu keys and where to find things, please email me, let me know. We'll do a private chat session on Blackboard, and we'll go over it in person. And Getty?
So where's gonna be the first test?
Say that again? It's going to be in a tab that says exams, where it says exams.
Exams. Okay.
I don't know if I can see it from here. Examinations. You know, the tab isn't open. The tab isn't open yet. You'll see it when you log on next week.
So to be clear, the test is gonna be tomorrow. I mean, the next week, 2:10, available until 4. You said, right?
I'm sorry, you got a little broken up there.
So you said, to be clear, you said that the test is gonna be next week.
Next Monday at 2:10 p.m.
Okay, until 4, and then at 4 we're gonna meet to review the question, right? That's it.
At 4 o'clock, we will be live reviewing the questions.
Okie dokie.
Olga?
Yeah, I keep asking for my 10 points because I didn't see any changes in my grade. Because the first time in my quiz, the first one, I got 70, right? And I
All
didn't
right.
see changes.
Shoot me an email and I'll re-review your quiz
All right. Thank you.
manually. No, Asher, I really can't do that. That's just too much data. That's why it's all on Blackboard. If you need help going over accessing all the tabs, let me know and we'll set up a time to go over it. All right, guys, this presentation will probably be available maybe tonight, tomorrow the latest. Have a good night, everybody.